Hello and welcome to Anxiety Diaries, a weekly podcast about mental health, incredible people, and so much more. I'm your host, Scott Newmeyer, and I'm very excited today because we have our first interview. Most of these episodes will end up being interviews with incredible people, but today's the first one, and it's a very exciting one. I don't want to talk too much right now because this is a long, wide-ranging conversation that I have with our guest, and I really think that you guys are going to like it, so I really want to get into it very quickly. But if you want a brief idea of what we're going to talk about, we're going to talk about chronic illness and pain, and what do you do when you deal with chronic illness and pain and doctors don't believe you. But we're also going to talk quite a bit about mental health, as there's a large component that deals with mental health. That's what we're going to talk about today on Anxiety Diaries. Now, just a quick disclaimer. I am by no means a medical professional, nor are many of the guests you'll hear on the podcast. If you need help, please seek qualified medical attention. With all that said, take a deep breath and relax. Here we go. Today's guest on the podcast is Abby Norman. She's a science writer based in New England, and her work has been featured in Harper's, The Independent Literary Hub, Atlas Obscura, Medium, and others. She's been interviewed and profiled by NPR, Playboy, Glamour, The New York Times, Forbes, and many other international media outlets. Her debut book, Ask Me About My Uterus, A Quest to Make Doctors Believe in Women's Pain, has been praised by The New York Times, The Washington Post, New York Magazine, The Wall Street Journal, The New Republic, Book Riot, Bust Magazine, Bitch Magazine, and others. She's also the host of a daily podcast, Let Me Google That, on anchor.fm, and lives on the coast of Maine. Abby is an incredible writer, and she has an awful lot to say about illness, pain, doctors, mental health, and so many other things. So without further ado, here's Abby. Welcome to the podcast, Abby Norman. How are you?
Thanks. Yeah, I'm doing okay. Yeah. I'm like really happy to be here and talking about it. This is a really fantastic concept for a podcast, and I'm excited to get to talk about some of these things because I don't have the opportunity to talk about them nearly enough.
Yeah, we're really excited to have you. The book, it's interesting because the book is a lot about chronic pain and illness and things like that. But there's this underlying thing of mental health in there as well. And I think that, the things I've read that you've been doing, you've been talking a lot about the chronic pain and illness parts, but nobody's really given you the opportunity to talk much about the mental health parts. So I'm excited to hear from you.
Yeah, and I think it's so important to not let that piece of it, kind of skirt by unexamined, because it was definitely and continues to be really pertinent, in my life. But I think what I'm hearing from people as they're reading the book, and I'm getting kind of inundated with these messages, which is like its own kind of like grappling with how do you practice good self-care when people are sharing these like really terrible stories with you day after day after day. But a big component of that for all of these people who've reached out to me is, how do you cope with this on an emotional level or on a spiritual level? And that's something I'm still very much in the process of addressing in my own life. So I think it's important to communicate to people that that's an ongoing process and that it's a really valid and important one.
Yeah, I think it's something that, anybody who writes about health, mental health, any of these things, we all kind of deal with it, I guess. We end up getting emails saying, how are you doing this? Tell me your secrets. But we don't really have secrets. We're just trying to live too.
Oh, yeah, for sure. For sure. And I think, too, there's this idea that it's something that, or maybe we all kind of get stuck in this mindset. And I think part of it is like a broader, maybe this is like a broader criticism of our society that we think this, but I mean, I always get the feeling that, and I catch myself doing it too, there's this idea that it should be something that you should be able to fix, or that there should be an answer for, rather than framing it as being like an ongoing process for your whole life. Like, I think there's a drive, and this is like kind of reflective of the larger healthcare system for physical issues as well, there's this idea that you need to like address it and fix it in a really definitive way. And I think a lot of times that comes down to it being like, okay, well, we're going to prescribe this really specific treatment, and then you're going to take it or you're going to do it, and then you're fine,
right?
Or then you're fixed. Like now you can just be a functioning member of society in a way that is, meeting some arbitrary set of expectations. But what does that really mean for people, especially when you layer on like all the things that influence somebody's ability to even access any of that to begin with, let alone if it doesn't work or if it works for 6 months and then it stops working. I mean, there's just so many layers of it that need to be examined. Like it's so not a one size fits all kind of issue.
Absolutely. And I think it bleeds over into not just mental health, but, regular health as well, especially in cancer. I know Mary Elizabeth Williams' book, series of catastrophes and miracles, or miracles and catastrophes, one or the other. Anyway, she talks in there about how, she really didn't like to hear you're fighting cancer, because it implies that if you don't beat cancer, you didn't fight hard enough or something, to that effect.
Oh yeah, that's such a really poignant sentiment. I mean, I think about that a lot in my own story of chronic health problems and chronic pain, that there is this idea of, the ultimate goal at least in Western society, it seems like, is that health is something that you should always be trying to go back to, like right. Good health, being in whatever that means. And that if you're not, even if people are aware on some level that there are a lot of things that are contributing to you not being in quote unquote good health, there is always this kind of underlying thing of like, okay, but you've been sick for like ever. So like, why aren't you better? And,
right.
There isn't this concept, even like anthropologically in our culture, of like being able to really live a good life or live a meaningful life or live a productive life or like whatever that kind of expectation is, if you're somebody who is in any way not consistently or for the most part in good health. And I think that's really something that I had not necessarily ever, I don't know, not something that I'd really felt. Like, I mean, I'd thought about it and I'd intellectualized it, but only very recently have I started to kind of consider the emotional ramifications of that.
Yeah.
Particularly when I feel so that I am not in control of so many of the factors that determine that. But I think it's really interesting that we frame like, not just physical health, but mental health too, in that kind of, with that kind of dualism.
Yeah. All or nothing.
I don't think it's helpful, but yeah, it's a very pervasive way of thinking about illness, and one that really creates, because it is so black and white. I mean, it really does kind of put people forever in the either or. And so what happens to people like in my circumstance who are progressively in more of a state of illness than they are in a state of wellness, but to degrees and along a spectrum? Like, how do you live on that spectrum,
right?
Where you're not consistently in one or the other,
and feeling bad about it because you are.
Exactly. And I think that's very true, not just with physical health, but with many mental health issues. Like, I was talking to a friend the other day who was sharing and like opening up a little bit to me about her experience being bipolar. And I was like, I just know very little about it, other than through like anecdotal things that she's explained to me about what it feels like. I mean, again, it's like you can have a certain level of like, DSM like levels of understanding intellectually, but you don't really understand it unless you've been through it or you're close to somebody who's been through it. But she was sort of talking about this feeling of like trying to understand what it means for her to feel that she's doing well and that she's functioning, and that might be like really, really far away from what society might think. or what it thinks at the larger level that it should mean for her. And I was kind of recognizing that is also very, very true for me in terms of like this idea of having a chronic illness or a chronic pain issue that's affecting me in a very visible way physically.
Right.
That there were all these things that, and again, one of the things that we bonded over was how much time we spend and how much energy, very limited energy, that we spend in our respective lives just trying to make ourselves appear presentable enough that we don't make other people uncomfortable.
Right. Yeah, you always have that feeling that you have to kind of play up. You always have to be on to make everyone else around you feel better. And that needs to change, I think.
Yeah, and I was like, that's so, it's such an odd thing, because I'm like, at the same time, like then I wrote this book, which I grappled with just how vulnerable I really allowed myself to be in terms of some very explicit parts of my life that I talk about, not even just in terms of like the vulnerability in the physical sense, but in the emotional sense, and sharing some things that I'd felt or thought or experienced that even some people very close to me didn't know until they read the book. And for me, there was just this feeling of like understanding how much it would mean to me to have those experiences validated in a book, and like that I suspected other people would feel that way and would respond to it. But at the same time, like here I was very aware that was something I needed to do if I was going to tell the story and have it help people in some way, or position it to be helpful in some way. And yet in my real life, I'm still, even like, even right now, as I've, been quite sick actually. And also, just going through some other weird stuff. Like, I got laid off from my job, like in the middle of all of this, which was very unexpected and kind of a bizarre wrench to get thrown in. And so people have been like, okay, what can we do to help? And
Right.
and what do I immediately do? Like, oh, like it's fine. I'm dealing with it. Like I there is this feeling of needing to protect other people or put other people's comfort ahead. And a lot of that actually was less about, I realize as I've had time to think about it, and why I was really excited to kind of like have a chance to talk about some of these things, is that a lot of what I was trying to keep people away from or not burden people with was not so much the state of my physical health, which is very much at a point where people just look at me and it's very obvious, but I didn't want people to get too much into the emotional stuff. Like
Right.
that was what I felt I really had to keep people from. And that was really eye-opening for me, because I was like, how do I reconcile the fact that I was very willing to write this book where I was really emotionally vulnerable about some of these things that have happened to me in the past, but yet I don't feel that I'm allowed to do it or that I should do it in the present. And I just thought that was really interesting. And I think it speaks to this idea that mental health and physical health are both kind of a continuum, rather than being things that you like encounter and fight, if you will, or you have to overcome, if you will, and then all of a sudden, like, it's solved.
Right.
Like
there's no straight line. It's very, very wiggly.
Yes, very wiggly.
So I want to go back real quick because some of the listeners may have not read the book yet. So your book is Ask Me About My Uterus. Can you just give us a little brief kind of gist of what it's about for those of the listeners who haven't read it yet?
Yeah. And I think a lot of it's actually said more in the subtitle, which is a quest to make doctors believe in women's pain. So really, it's a combination of a lot of research into that broader issue, specifically around a condition that I have called endometriosis, which then actually led to a number of other things. But basically, when I was like 19 years old, I was a sophomore in college. I was like, befallen by this illness that really had been, when I look back on it, had been chronic and had been something very much related to my menstrual history for most of my young life, but ultimately became an acute issue because I had a number of things sort of going on in various systems in my body that it took a very long time for me to get properly diagnosed. And ultimately, there really wasn't a lot to do in terms of treatment because things went ignored or dismissed by the medical establishment for such a, you know, long spans of time that it's kind of like the damage had been done by the time anybody took me seriously, kind of thing.
Right.
But I figured out fairly quickly into this process that part of the reason that I was being dismissed was because doctors were really, really convinced that I was only in pain because I was stressed, or I was only in pain or only ill because of some other sort of like psychosocial problem that wasn't actually linked to any organic illness that was something detectable physically, which turned out to be not once but twice an incorrect assumption.
Right.
But what has been so interesting, I think, as I've had, and I go into this a little bit more in the book when it's something that I have talked about a lot more in recent history, but this idea that like I never denied that there's very, very important and worthy of our consideration connections between the mind and the body. And in my own personal history, there were a lot of things in terms of the mental illness history in my family, my own struggles with depression as a young person that were really, really pertinent to this story. But it was really, I think, in a way, not just frustrating, but ultimately life-threatening for me that the ways that the medical profession handled these issues, primarily in their treatment of women, is based in a very, 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 very complex and long history of categorizing women in these encounters in a way that they don't actually have the ability to know the difference,
Right.
or that they can conflate these things without even realizing it. And I think that, obviously I go into this a lot more in the book in terms of like historical context and the broader socio-political context, which is obviously very much like on topic right now.
Right.
But I think what's interesting is that for me, ultimately what happened was that even though the insistence from the beginning was that I was in pain and that I was sick because I must be anxious and depressed and hysteric, if you will, it was kind of actually what ended up happening was that it was very much the reverse. I got sick and started, entering into these interactions in the healthcare system when I was kind of in like the prime of my life. I was at this college that I had worked really hard to get into. I had, probably the best social life I'd ever had in my life. I was healthy otherwise. I was a dancer. So, I had a lot of good physical activity. I was, in and around New York City, and, somebody who grew up in small town Maine, that was about as exciting as it could get. And, then I got sick, and sort of over the last 7 years, as I've continued to have progressively more and more issues and I've lost more and more of my life, I have absolutely become not just like depressed about that circumstance, but wrapped up in these really intense sort of anxiety spirals, because even though, I ultimately did have interactions with the healthcare system that like proved that I actually had a physical problem, I still, to this day, even though I've had interactions like that over and over and over again, where I have gone back and I have fought and said, no, I really think this is the problem, and then it turned out to be the problem, I still have so much anxiety about going to the doctor that even when I was on the book tour, I was in New York a couple of weeks ago and I was on the book tour and I knew I was getting sick. And even in my mind, I was like, I have an objective sign of a fever. I have new pain. I know this is probably serious, but I put it off for like a week. And then by the time I was in urgent care, I was like, almost at the point of having like sepsis from an infection, because I was so anxious, and almost to the level of like, I would say, and this is probably something that people with chronic illness do absolutely experience, but a certain degree of like post-traumatic stress, that I was really quite paralyzed by the fear of having like a shameful encounter with a doctor, as I've had so many times, that I like endangered myself, even having had experiences, that had not been that in the past. I mean, it was just, it's become like this very complex thing where when this all started, I certainly wasn't in this place emotionally, but man, after like 7 years of it, I am absolutely in a place of I would say, you know, sort of a very complex depression anxiety spiral, which is a whole nother layer of health that needs to be like properly addressed and treated, and that absolutely influences the physical state. And I think that this is so true for people with a number of different problems that are, you know, that become chronic for them, that either to do with pain or some other symptom that like really influences their quality of life. And, you know, I just think it's really important to be aware of the ways that they interact. But at the same time, I'm also like very, in my own mind, aware of how much I feel like that's become like an identity thing for me. Like I keep being like, well, why am I resisting this so much? And I do think a lot of it comes down to like, I don't want to identify as being a sick person in any way.
Yeah.
Like, you know, that's
Nobody wants to.
exactly. Like nobody wants to be in that. You don't want to be in that club.
Right. You don't want to be the person there like, oh, she's sick. You know?
Yeah.
And why?
Yeah.
Why do we say that? Why do we not want to be that person? That's the problem, I think.
Yeah, and I think there's this element of like not like for me, I mean, certainly, you know, whether or not I choose to identify one way or the other doesn't change my physical reality. Like I still am going to feel sick whether or not I say I am sick, but it's this idea that like, you know, you're sort of taking on an identity that you know has stigma attached to it. Like, you know, I've had several conversations recently with people who are like, you know, people who I definitely consider like close friends, but from whom I have even kept a lot of sort of the more, you know, I guess intense struggles I've had around this idea. And they've been like, you know, you're just really, they're like, you're just so bad at asking for help, but you're like worse at accepting it. And I'm like, yeah, I mean, I won't deny that. But I think where a lot of that comes from is this feeling of like, I'm just very aware of how much I don't want to feel that I'm burdening people. And I think that that's a theme that probably and I'm sure as you do more episodes of this will come up, because I know in every conversation I've had about either chronic illness or particularly mental health issues where people are really struggling through that process of trying to find the right treatment for them. And they're grappling so much with that feeling of being a burden in some way to somebody.
Yeah. Well, you talk about this in the book too.
Yeah,
I mean, you talk about the way, you know, and this was one of the things, I have highlights all over this book, but this was one of the first things I highlighted was the way you said, the way your mother treated you. You know, you say, I took her revulsion personally, as I think any child would, and vowed never to get sick again. And you kind of consider those things as personal failings if you did get sick. And now you have to deal with the medical profession also treating you that way. So it's inevitable.
Yeah. And I think like one of the things that was so interesting about writing this book was that I was very aware that the thread of my mother's story and also her mother's story was incredibly important. But people have been very divided. Like as people read the book, they're like very divided about whether or not they care about that part of it. And I think it's really interesting because I can always tell the people who have read it and who don't care about it ultimately end up being people who are like just had no comparable experience to that. Like they probably don't have anybody in their life who has had a mental illness to that degree, or even that they know of anyway.
Right.
And yet, you know, there's this whole other, you know, response, you know, from people who immediately understood why that thread was important and who didn't question it at all. And I think it was really interesting for me because I know I grappled so much with like, well, how much of this do I talk about? Because I think the context is important, but you know, I don't necessarily want to, you know, talk more about this than I have to because it's really difficult. And it's something that I'm still processing in my own life. It's not like, you know, that was not that long ago. I'm going to be 27 next week. So I'm not like, I don't have like 30 years of distance between me and a lot of these things. But I know that my, you know, going through my childhood, with my mom, who had a number of really challenging health issues and mental health issues, and was also then dealing with like the legacy of her mother's very severe untreated mental health issues, which were very much a product of, first of all, living in a really small rural area in like the 40s, 50s, and 60s, where she had literally no resources and no help.
No one to talk to.
And no one to talk to. And it was such a really prime example of like intergenerational mental illness, where this ended up being something that, ultimately had a really life altering impact on my mother, which then was ultimately in some way passed down to me. I mean, and then, we all were living within, a pretty close proximity to one another. And then it was like this sort of triangulation of fighting through those issues, with all of us needing very different things and being in circumstances where we just didn't have the right access.
Yeah.
And I think that is something that a lot of people can relate to, primarily in this country, because healthcare access, whether you're trying to get mental health care or, health in the physical sense, is the disparity is mind-boggling.
Oh, it's terrible. It's absolutely terrible. I had to jump through hoops just to get, Zoloft at a reasonable price, because they just assume that, the generic works for everybody. But that's not always the case, It's kind of crazy. Do you think it's getting better? Do you think it's I mean, we have things like now, like the stigma, at least. Do you think it's getting better? Hypochondriasis is now called illness anxiety disorder because of stigma. Do you think that it's getting better? It's starting to erode a little, maybe?
I think again, it definitely is actually, maybe more than anything else, to some extent, a question of where you live and the degree of like socioeconomic privilege that you have, which I find is really important and influential for one's ability to access medical care of any kind. But I've noticed that, like, for example, in my life, I split my time between where I live in like rural coastal Maine, which is also where I grew up for the most part. And, then for when I'm healthy enough, going places for the book, or when I was working and going to more metropolitan areas, mostly New York City or Boston or Washington, D.C. And I certainly am very aware of the fact that when I am in other places, the conversations about these issues, whether they're more formal because I'm being interviewed, or more, informal because I'm just talking to friends I have who live there, or even friends I have who just grew up in different circumstances, that the conversations are more open. And I think that is sometimes also reflected by the conversations I have in certain circles on the internet, which, particularly when I'm in Maine, that becomes even more important for me in order to keep perspective, because there's not so much of that, not even just acceptance, but awareness, when you're in a smaller, kind of more isolated rural place. And I think that for me, that was another reason why it was really important to like write a book or produce something tangible, because I was very aware of the fact that, when I was a teenager, or when I was a young person growing up in a rural place, not only did I not have access to like broader resources, I just didn't have access to like broader thinking or broader conversation. And what really made the difference in my life was being able to go to a library, or, later order a book from Amazon or whatever, and be able to make those, be able to broaden my horizon that way. And that was very true for me emotionally as well. And I think that, certainly in terms of trying to address the stigma around like the mental health component, I think that's something that, as much as, one's own personal journey is like a continuum, and something that is going to change depending on where they are in their life and what other things are going on. And like your needs are always going to change, or there are going to be things out of your control, like they're going to change the formulation of your drug, or your insurance isn't going to cover it, or you're going to lose your insurance. I mean, those are things that are absolutely part of that process and part of that journey that you have to kind of cope with as they come up in the best way that you can. I think people's willingness to be more open to discussing all the elements of it. I think about like, on Twitter, like the talking about it hashtag, which Sammy Nichols started. I mean, I think that's wonderful because there's so much, even for me, like being able to say, okay, I'm going to be really, really open about these physical things that I went through, to kind of hopefully create space for other people to do the same. Like it wasn't so much about me telling my specific story as it was me being the person to just kind of throw my hat in the ring and then hope that other people would do the same so that we could see what a broad experience it really is and like what the spectrum of experience really looks like. And I think that for addressing that stigma at the mental health level, we have to kind of do the same thing. But I almost think that the stakes are higher because, like I think about how, I have a number of, physical problems that are sort of over time have become kind of progressively more serious and that certainly are threatening to my life in one way or another. But then I think about, growing up with my mother and, she has it. I say has, but I mean, it always feels strange to say it because it's just one of these things that I'm really aware people always associate with young people, and she's into her middle age now, but she's very profound anorexia nervosa, and her eating disorder was a huge component of my formative years. And our understanding of something like anorexia, which becomes ultimately in one way or another a physical illness that is life-threatening, is predominantly life-threatening because so many people with eating disorders commit suicide. And I think that one of the things that I didn't appreciate really until quite recently was that, honestly, like in terms of like, I mean, maybe in some ways it's kind of, making a comparison is like a slippery slope, but, for other reasons that don't have to do with anorexia necessarily, in the sense that anorexia is can be both a like medical condition that is brought on by something else and then can also be attached to the mental illness as well. I've lost an incredible amount of weight in a very short period of time due to some kind of metabolic issue, or they're not exactly sure,
physical illness.
Yeah, there's something very like I'm in a hypermetabolic state for one reason or another. And what has been so alarming to me is that I am now at the point of like emaciation that like my mother was when I was a little girl. And there's something very kind of harrowing about that, about looking at that and confronting it and trying to say, well, this is how it's different. But then also recognizing that on the outside, people would look at me, and people are looking at me and thinking, oh, wow, you're very ill. Like there's something very terrible going on. And people are like really, really trying to reach out and help me. But when my mother looked like this, but everybody knew it was because she had an eating disorder, people didn't help her. They were very cruel to her. They were very critical of her. They blamed her. I, even as a little girl, didn't understand and was very like not understanding and just was mad at her because I felt like she was, putting her disease ahead of me, and like I didn't understand why. And I mean, I recognize now that like in a way, really, not that I think that, everybody should go around making comparisons, but I mean, I think there's a really like obvious reason why I would be thinking about these things and making these comparisons in my life. I think in a way, like she was really in a far more precarious place than I have ever been, because even though I've really struggled to have adequate healthcare and have my illnesses and my symptoms taken seriously, up until quite recently, I was not necessarily dealing with the mental health stigma piece of it, and she was. And I really think that was a lot of the reason why, her life was so endangered and still is in many ways. And then you add on the mental health component in terms of just her own, like struggle internally, which is far deeper than I will ever understand, sure. But I just realized that, like, I guess what I'm trying to say is I feel like it's just very odd that people would, can look at two people who
look the same,
are Yeah, and who are
but
supposedly
judge
in
them
very similar
differently.
circumstances. Exactly.
Yeah.
And that their willingness to reach out and help
Right.
is really like, what's the difference? Oh, well, the difference is, quite frankly, that people have looked at her for my whole life and blamed her and felt like it was her fault that she was like that. But they look at me and think it's not my fault at all, and that therefore I'm deserving of help. And I think that's just, I mean, even just saying that, I feel like nauseated about it because
It's
it's just
terrifying.
such a horrible, horrible thing to think about.
Yeah.
But I can't like, but I can't not acknowledge that that's the message that people get. And I don't know how we change that though.
I think I think maybe we're moving in the right direction. I mean, just the fact that more people are talking about it is good. You know, we see The Rock, right, talking about depression, and
Yeah.
everybody's like all up in arms about it and excited, and that's good. That's anything that moves the conversation forward is good. And I think one of the things that really shows that we're moving in the right direction is the response to your book. I mean, you've gotten, I'm sure, a deluge of emails, thank yous, people reaching out. And that I think that can only show that we're moving in the right direction.
Yeah, it's been incredibly like humbling and also very overwhelming because one of the things that I really can't wrap my head around is how I could possibly get this many messages from people on a daily basis and have them all be the same. And these are all people who are different. They're living in different places. They're of different socioeconomic statuses, different ages, different generations, very different social like support systems. And they're all telling the same story of pain. And I just think, on some level, I mean, there's definitely a feeling of like, wow, I'm so not alone in this. And like these people now know that they're not alone in this. But also, you know, to think about how long a lot of people have suffered and felt that they're alone, is really kind of haunting to me. I always tell people that the messages that I get that keep me awake at night are not the ones that I necessarily get from the young people who are like just at the beginning of their life, but they're now armed with this information. It's the women in my mother's demographic. It's the women who've been living like this for 35 years and barely able to, like in their words, like keep it together or like do just the bare minimum of what they think they have to do to take care of their families and hold down a job. And I'm just like, that's what I'm the most terrified of, I think, and
they're like, where was this information then?
Right.
Nobody was talking about it then.
Right. And I think that there's like something to feel hopeful about in terms of like making it better for the next generation. But I also think on some level, the next generation doesn't really seem like it needs like too many of us like
No.
getting older folk to like help them. Like they're all like ready to fight. Like they know
Yeah.
what's up. Like and I think on some level I take some I get some hope in that. Like I look and just think like, this is we're coming into this sort of like shift socially where I think it's not even so much these kids are ready to come out like fighting kind of thing, but they're just so open to these conversations. They're so open to even even more broadly than just talking about these issues. They're just ready for that inclusivity that a lot of people in older generations are really, really not ready for, and that they may never be ready for. So I think trying to focus on, like going where the conversation is ready for it and being there, and being present in that is going to be really important. And I'm glad that a lot of it is able to happen online, because that's the other thing too, is that I think that for so many people who are either chronically ill physically and or mentally, the internet is, it's a double-edged sword for everybody, but it can be a really invaluable resource, especially for people who are really kind of homebound. I mean, I haven't really been able to work outside the home for a couple of years. Not really. And right now, I absolutely can't. I mean, I actually really, to be perfectly honest with you, have very minimally left my house for the last couple of weeks because I've just been too ill.
Right.
And if I didn't have my like support system through the internet, I don't know what I would do. I really don't. It would be very, very difficult to get through any of it if I didn't have that.
I agree. And the internet has been huge for me too. Someone who's dealing with just anxiety. not wanting to go out and sit and meet with people as often as, others might. The internet has been great. It's super inspiring to see what these kids are doing, and especially on social media. It's really, really cool. So I want to talk too, though. God, that's a lot to digest, but the book is so good. And
thank you.
You're very welcome. There's something in the book too that leads me to what I want to talk about next. I want to talk about your podcast, your daily podcast.
Oh God, yes.
Abby has a podcast called Let Me Google That, which you can find on anchor.fm, the Anchor app, and pretty much everywhere else you get podcasts. So basically, it's little tidbits of facts every single day about things that, you might want to Google yourself. Abby's doing it for you. So one of the things in the book that I could have totally seen being on this podcast was when you talk about the pain scale. And when you talk about how they were creating it and what they would do to the pregnant women. You'd have to explain this very quickly just for the listeners, because it is one of the craziest things in the book. And I think people probably glance over it too quickly.
Oh yeah. So I was really happy that, when Randy Epstein did the New York Times book review of the book, which, side note, was wild. I can't believe that even happened. But I was so glad she pointed out this anecdote, because it was one of my favorites that I came across in the research. And I actually just really couldn't believe that it was a real thing until I actually dug up the study and was like, yep, they did that.
Crazy.
So basically, people are familiar with, if you've ever been in an emergency room or even a doctor's office, you've probably encountered the pain scale, which is basically when the doctor's like, where's your pain on a scale of 1 to 10? Now, the thing is that the pain scale is really supposed to be about sort of comparing how pain changes over the course of that encounter. So if you're in an emergency room, when you first come in, they're going to be like, where's your pain on a scale of 1 to 10? And the reason they're asking you is really because they're then going to compare it again after you've had, say, a dose of acetaminophen,
right,
or they've done something to you, so that they can see if it changes. It's meant to be sort of referential in that way, but that's not really how it gets used. What ends up happening is that they triage people and they sort of make assessments about people based on this pain scale. And the patient then thinks that the pain scale is meant to be some kind of really definitive thing. And we're all really aware of the fact that we live in our own body, and we're the only person who lives in our own body. So our idea of what a 5 or a 6 is might be really different to somebody else, especially if they've had different experiences with pain. So one example would be, of course, that so I've never had a child. I've never been pregnant, but my best friend had a baby 5 years ago. And so if I'm describing my pain, I can't really compare it to pain that I haven't had. So I would compare it to the worst pain I've ever been in, which would maybe be a ruptured cyst or something, or whatever, terrible pain I've had. But then she would always probably use childbirth as a measure of her spectrum of pain experiences. And that's actually not really far away from what researchers sort of in the 40s were trying to do in terms of establishing objective measures of pain, because pain is inherently very subjective. It's really almost entirely subjective. And the great mystery of medicine has been trying to quantify it in some way, so that it can be more effectively identified. And so one of the ways that they tried to do that was to form a pain scale, and they needed to figure out a way, basically, to put people through a lot of pain so that they could ask them about it, and they could try to devise measurements for it, numerical measurements. But they were like, okay, we can't even get to the upper level of the painful experience threshold in a human, because we would probably kill people, and we can't do that because then they'll take away our funding. So
I'm cringing already because I know where we're going.
They were like, so we just got to find something that's a really painful experience, but it's not necessarily going to kill anybody. And then they were like, aha, we should go into the obstetric ward at the hospital and talk to the women who are in labor, and when we could talk to them about pain, because they're going to experience really extreme pain, but transiently and they're like probably not going to die from it.
Oh,
And they're already in the pain, so it's not like we're doing it to them. So what they did was they went into an obstetric ward at a hospital in New York City, and they encountered some women who were willing to be part of their study. And so as the women went through labor and delivery, the researchers were also burning their hands with these little devices that would have, varying degrees of temperature, so that they, like little electrodes kinds of things, so that as the women were experiencing increasingly more painful contractions and all of the other, myriad discomforts of childbirth, that they were then trying to compare it to this like burning sensation, which the researchers had kind of set at particular levels, which they called doles. And so what they were trying to do was establish like the highest level. So like, what was a 10? And so what happened, kind of like the long way around here, they weren't really successful in doing this. And part of the reason why was that as the women were in more and more pain from their labor, they were much less able or willing to communicate like the specificity or the specific qualities of the pain they were in, because they were in so much pain they couldn't focus on anything else.
Right.
And so, I mean, that was kind of like they did all this research, and I mean, they really tried to approach it in like the most methodical, strategic way possible, and that really set them up for success. But the ultimate truth was that, pain is something that can become very quickly all consuming, and it's not something that anybody who's not in that experience could really understand. And so we still haven't really gotten to a place where we've been able to quantify it in the way that we once set out to. But yeah, that anecdote was really
That's crazy.
Kind of powerful. And I think actually you're right. I should do a podcast about that. And maybe I will, because
You should.
It's funny. I was like, actually there's a lot of stuff that like, because I wrote about it or I've written essays elsewhere about it, I forget that I like that's something that would be good on this podcast.
Right.
But I was like, oh yeah. So yeah, maybe I'll do that.
You should. Week. I mean, and the craziest part is that there were women that were volunteering for this.
Oh yeah. So I mean, well, the thing is that they actually they happened to encounter a number of women who were either married to doctors or who had been nurses, because this was in like the 40s, so it was just post World War II. So a lot of these women had actually been educated in medicine to some degree, or they were familiar with it. And so they actually volunteered to do it because they understood how important it was to try to quantify pain, because they had either experienced in their field work, or they knew from, whoever, they had doctors in their family, or they were married to a doctor. Like they understood just how vital it was to do that research. But I was like, yeah, I'm like, really? You're going to just tack on more pain?
Yeah, sure. Put my hand on fire.
Yeah, light my hand on fire. It can't get any worse than this, right? Like, we'll just go through that.
As I was reading, I just kept thinking, I'm like, you could totally see this on The Nick, the Showtime series that Steven Soderbergh did. It's crazy. Oh my God. Actually, yeah, that's really funny, because that almost sounds like something that would be on a show like that. Yeah. Because it really did feel like, in a way, the fact that, we really, and even since then, the attempts to sort of do this have failed pretty miserably, just because, it is sort of the great, like, mystery of the human body. It's like the vagaries of how we experience it, but also the language that we use to talk about it. And that was one of the things that they found that was really the most interesting, was that while the women were still communicative, they would try to compare and contrast the qualities of the pain. So labor pain felt very different from the pain of like having a hand on fire. And they were able to articulate that. Yeah. And that's something that has actually become more and more accepted as being like almost more important to the diagnostic process, or at least as important in terms of like talking about pain, is not just like how much pain you're in on a scale of 1 to 10, but what kind of pain is it? Because a gnawing type of a pain versus a burning type of a pain are probably going to come from different things. So whether you have an injury or an infection, or you've experienced
something that's more acute versus something that's more chronic. I mean, these are all like really important things that need to be considered. But, you know, I also think actually, just even as I say that, I'm thinking about how true that is for dealing with mental health as well. Because I was actually, as I mentioned to you, I was just talking to my therapist, who I've seen for many years, and I've seen many for many years. Like, I mean, that's a big part of my, you know, self-care that I am completely always very transparent about. And I was talking about how there's like this interesting experience for me right now in trying to reconcile what I would consider like my chronic struggles, for, you know, with varying degrees of depression and anxiety versus the more acute kind that has resulted from, you know, losing my job and having a really scary health experience that was more acute versus the chronic stuff I've been dealing with every day for 7 years. So it's almost like, in a way, actually, I have found it more difficult to deal with like the acute feelings of depression as opposed to like the more chronic stuff that I had learned how to cope with and manage over the course of many, many years. So I think like for people who maybe have not experienced like both, because I think that there are many circumstances, like you know, if somebody's grieving something or someone, you know, we talk about like different sort of the different sort of spectrum of mental illness or mental health experiences that we can have in our life, but also the ways in which they become very layered. So you may have a sort of like lifetime experience of anxiety that gets, you know, more acute because something happens to you, like a relationship breaks up, or you get in an accident, or you lose your job, or you just have a life change that isn't even necessarily bad. Like maybe you're just moving to a new place, but you just have something that shakes up your life in some way, that you have to learn how to kind of deal with both. But for me, the big thing is, well, how do I know which one is more like needs my attention more? And I am, to be honest with you, I don't really, you know, I don't know. That's something I'm trying to figure out. But I think that's another conversation that's really important to have when we talk about, you know, trying to improve care and treatment, and also just being open to these discussions, is understanding that, you know, you can have both. You can like, I mean, like, it's a lot to have all of that, but I mean, it's something that definitely does happen. And there needs to be this like sort of understanding that, again, it's not something that you just like get over or assimilate or, I don't know, fight. Like I keep going back to that thing you said at the beginning about like fighting it,
Right.
you know, because I mean, that's, you know, you'll always be fighting it in some way. I mean, there's not like, you're never going to like not be, as long as you're, you know, here and you're alive. That's, it's always going to be part of what it means to like be in your body and be moving through the world, you know, in your way. And I think that we all just do the best we can to find the ways that are best for us to cope with the resources that we have, which are going to be very different, depending on who we are and where we are and who we have around us, but also in terms of like, it changes over your lifespan. I mean, the things that worked for me when I was 16 a lot of them don't work for me now, or they aren't available to me now. But also, you know, because I've had so many, even something like, you know, thinking about the ways that your physical health affect it. I mean, I just literally weigh 30 pounds less than I did 6 months ago. So medically, even in terms of trying to like, you know, take medication that was prescribed to me 6 months ago.
It changes.
It absolutely changes, like the effectiveness, or the safety of taking something like an Ativan is very different for me now.
Absolutely.
I mean, and that's something that actually my doctors weren't even thinking about. It was only when I started to say, geez, I don't think it's actually safe for me to take this dose anymore, that they were like, oh yeah, geez, maybe that's a weight dependent thing. And I'm like, you think?
Right. And
like,
it works the opposite way too for people that gain a lot of weight.
Mm-hmm,
you know, that you need to go up in your dosage. It's crazy. And, you know, I think there's thought in anxiety and mental health that's moving in the direction you were speaking about too, which is kind of acceptance rather than fighting, right? I think Sarah Wilson talks about it in her book, First We Make the Beast Beautiful. She talks about how,
I love that.
have you read the book yet? If not, you should. It's great.
It's on my list. Yeah. And I'm so glad you brought it up because you reminded me that
it's really good. So she talks about how, instead of fighting what she knows she's had for all this time, this anxiety, it's kind of like she got into a point where she's like, well, this is what I have. Here's how I live with it the best that I possibly can.
Yeah, absolutely. And I think that like that's something that I have been thinking about a lot in terms of like wanting to reconcile the ways in which, my experiences with my mental health, which have changed so much in the last year as I've gotten sicker physically and have become much like louder, because I think like there are so many times where like the physical stuff has taken precedence because it's been harder to ignore. And now I'm sort of at this point where I've been physically chronically ill for almost a decade, and I've actually learned how to deal with it and manage my symptoms to probably the best degree that I can with the resources that I have available to me. But all of that came at the expense of totally not paying a lot of attention to my emotional state. And a lot of that was because I knew it was going to be really overwhelming. And I think I was probably very afraid of it. But at the same time, I'm very aware of the fact that I just felt like it wasn't as important. And I think that that is the message that you get, like more broadly from society and like what society puts, sort of the focus on in terms of, well, as long as you can still be productive.
Absolutely.
As long as you can, and it wasn't really, I mean, honestly, it wasn't until like, like all my relationships evaporated and I couldn't work anymore. And, I just basically got to the point where I was like, what could anybody possibly think that my life consists of at this point? I was very aware of not even so much how it felt, but how it looked. And I thought, that's really screwed up. Like, shouldn't I have been way more concerned about what it feels like to live my life and like what my life feels like for me and to me? Like, why was I so concerned with whether or not it looked like it was enough for somebody else? Right. When it has been very difficult for me for much longer than I was willing to talk about. And I think that that's something that, people who are willing to go there and to have those conversations, like, will shift that. And I really hope it happens in my lifetime. I hope there is a day when I can be like really honest about the fact that, you can't separate all these issues. Like they're all important. And my emotional and mental health is just as important as my physical health. And I hope that there's a day, not just like when I feel like I can say that and not be not feel a stigma attached to it, but that I could just think it in my own head,
right,
and not immediately argue myself out of it. I think that would be like the big thing that I would feel would kind of be like a game changer, like a life changer.
I hope we're getting there. I think we can if we keep talking. Yeah. I think that's why stuff like this is important.
Well, that's why I'm so glad you're doing this podcast, and I'm going to be like a very loyal listener because I want to hear these stories. I need to hear these stories, and I think a lot of people do.
I agree. I love to hear these stories as much as, when I'm hearing them, sometimes my face will be flushed with anxiety and I'll be sweating because it conjures up a lot in me. But it's something that I think we all need. Which brings me to my last question for you. What are some of the things you do to practice self-care and to take care of yourself when things are tough?
Oh, that's such a delightful question. And I'm going to be very excited when I'm listening to this podcast and you ask other people, because I always love to hear about what other people do, not because of like comparisons, but because I'm very aware of like one of the things about me, like capital about me, is that I'm somebody who my whole life has always been just like a kind of like strange little organized list maker type of organizing person. Like that's a de-stressing thing for me. But I'm also really aware that I get stuck in a rut pretty easily. So I'm always trying to be inspired to challenge myself to try to find new things to fold in. for the pure, even just for the like sole reason of just trying something, even if what I'm doing isn't necessarily not working, but maybe there are things that might work better. So for me, a lot of self-care has really had to focus on alleviating physical pain or managing physical symptoms and trying to ultimately find ways to do that that are like using heat or I take a lot of baths, like like those types of things. But in terms of what I do to sort of try to keep myself on an even keel emotionally, I have to say, and I know this is going to sound like I mean, there are so many, I think people get really split about this, but I, within the last couple of months, started using a weighted blanket. And it's like I think it's like 15 pounds. It's not even the heaviest one you can get because I'm small. So I
Right.
was like, a 20-pound one is going to be too big.
It'll crush you.
It would. I would be like, I can't get up. Like, but I thought about it a lot at first because I thought maybe it would be a physical help, but also deep down because I was remembering. So the other thing about sort of my like past is that my younger brother Caleb has autism, and so that was another big piece of my story growing up, was trying to watch him, either not be able to access services or just not have anybody around him understand what autism was or what he needed. Although now he's doing wonderfully. So it all kind of worked out in the end. But when he was a little boy, it was really hard. And for me, as like the older sister who just wanted his life to be good, and be pain-free and be easy for him. And, it was just a lot of like, we did a lot of throwing stuff at the wall to see what would stick kind of things because we didn't have a lot of guidance. People were not talking about autism the way that they do now. One of the things that works for many kids with autism spectrum disorders, and definitely worked for him, was having some kind of like weight
Right.
And I think about, like, I remember when I was at Sarah Lawrence, I got to see Temple Grandin speak, and she was talking about when she got like, she made her like cow hugging machine that was actually for her, and she had to do like 2 mattresses that would just put pressure.
Right.
And so deep touch therapy is something that has been proven to be very beneficial to a number of people, not just with autism spectrum disorders, but anxiety as well. And so for me, I was recognizing that one of the things that becomes very quickly overwhelming to me is that I get very locked in my sort of, like mental sort of spirals in terms of like perseverating on things and trying to plan my way out of something because I think I'm going to feel better. And it was always at the expense of like totally ignoring how I felt physically or trying to not feel how I felt physically, which would often manifest in very typical, I think, sort of anxiety responses. And of course, I used to be a dancer, so I had a very, good sense of like what would, how do you work out like a kink in a muscle, or, how do you like do that? And I thought, well, how do I do that, but in my brain, but maybe also doing that physically? And then I thought, one of the things is that I've been pretty isolated for the last couple of years, just in terms of the nature of my work, but also as I've been ill. And I thought, I think part of it is just that I don't have a lot of physical contact with other people. And now I'm not saying that would be helpful for everybody, but I thought, maybe part of it is that I'm not, I'm like lacking something there. And I thought, well, one way to do that might be to do the kinds of things we used to do for my brother, because he actually he was not comfortable with physical, like affection, or which is fairly typical of kids on the autism spectrum. But he was like weighted vests or things that gave him that physical feeling of being sort of weighted, but wasn't somebody like grabbing him and trying to hug him or something. And so I got this weighted blanket, and I have to tell you, I have not slept this well in years. And it really does, even if I'm just sitting watching a movie at night and I'm feeling really ill, and I'm anxious because I'm ill, but I'm also anxious because I'm just kind of sad that that's my life kind of thing. Right. I mean, geez, it's just a blanket full of beads, but yeah, there's something about what it does in terms of like lowering my heart rate and just really giving me this feeling of being kind of calm. And maybe it's even a primal thing.
It's a blanket hug.
Like yeah, it's like a safety thing. Like there's something really quite profound about how well it has made me feel in those moments when I had gotten to the point where I thought that, I was just going to have to endure it, or, my doctor would be like, well, you just need to take a sedative. And I'm like, okay, but is there anything else I could do to do it that wouldn't be that, because I don't necessarily want to be knocked out.
Right.
I just don't want to feel quite so on edge. And so I have to say that really has been, just in recent history, the thing that I kind of took a chance on and wasn't necessarily convinced of until I did. And I'm very pleased with it.
Well, you sold me. I'm definitely going to try it now. I've been on the fence about it.
I think it's really worth trying. I think it's one of those things too that, like, even if it doesn't necessarily like work consistently, I think that even if it just works like one time that you really need it to work, like,
it's worth the money.
That's something that means something. And I certainly am somebody who is always appreciative of a good night's sleep, as is my body, especially one that doesn't require like a Benadryl or something.
Yep.
So I was really quite pleased with that. And then also I have a dog, and she's my other self-care. And I say that both in terms of her comfort as a creature, who also like definitely sleeps in my bed and is just next to me all the time.
Very cute dog.
She's very cute.
I've seen it on the Instagram. It's a very cute dog.
She's very good. But also she's a reason to, I have to leave the house every day because she has to go out and she has to be fed. So I have to get up, and I have to get up every day and try to be, somewhat functional because she needs me to be. Yeah. And I think that honestly, if I didn't have her, and I've had her for a few years now, I don't think I would have gotten through the last couple of years because I just, she is some days the only reason that I get out of bed at all. And I think that, I can't really speak enough for, whether it doesn't have to be a dog, but I think that everybody, can, look around and hopefully give themselves a reason or find a reason always. For me, that's her. But I think, if everybody could find it, that's kind of the greatest self-care gift you can give yourself, Yep.
There's always a reason.
Yeah. You just have to find it.
Yep. Okay. Abby, tell the people where they can find you on the webs.
Oh, I'm all over the place. You can definitely follow me on Twitter, Instagram, and my Facebook page. It's all at Abby M. Norman. And if you want to find out more about my book, abbynormanwriter.com is my website. And also there's plenty of information about the book just circulating on my social media, because I'm actually doing a giveaway right now for my birthday next week. So I'm always kind of chatting about it. And then, of course, if you are not so much interested in that, but you're just interested in random stuff in general, and perhaps on this podcast, you've thought that my speaking voice is like not too grinding. I do have that Anchor podcast. It's Let Me Google That. So you can listen in the Anchor app. It's also on like Overcast and Spotify and Apple Podcasts and Google Play. It's like everywhere. And you can also just go to anchor.fm/Let Me Google That and stream it on the web, and I post every day. And actually I'm getting ready to go do today's episode. So yeah.
I don't know how you do it every day. It's they're in depth, they're highly researched, and they're super interesting. So kudos to you for being able to do that.
Thank you. I'm so glad you enjoy it. That's great to hear.
It really is. And I'll put all this in the show notes too, so that you guys can all check out Abby, and please go check out her book, Ask Me About My Uterus. The subtitle, which she will tell you right now because I do not have it in front of me.
Yes, a quest to make doctors believe in women's pain.
It is fantastic, and it's well worth the read. Thank you very much, Abby. I really appreciate you coming on the podcast. It's been delightful.
Oh, thank you so much for having me. I've really enjoyed getting to chat with you.
Which brings me to my question of the week this week. Have you ever had an illness or a mental health issue that you took to a doctor or a therapist, and they didn't believe you? We want to hear your story. So please call us, leave us a message at 732-903-4441, or drop us an email. You could even email us a voice memo if that's easier for you, at anxietydiariespodcast@gmail.com. If you enjoyed Anxiety Diaries, please rate the show on iTunes, leave a review, and spread the word about the podcast. Those things really do help. You can find the podcast at www.anxietydiariespodcast.com, where you can sign up for our newsletter as well. And you can find us on Instagram and Facebook at Anxiety Diaries Podcast, where you'll be able to find all the show notes, links, and other things related to the show. We're also on Twitter at Anxiety Diary Pod. Thanks again for listening. Be well, and we'll see you next week.